All right, everyone, if we could take our seats, and if folks can hear me out in the wonderful snacking zone, please come step away from the juice. That's what I was enjoying. We have some wonderful folks on the stage who are ready to take this amazing deep dive into the state of Ohio. I am not going to introduce you. I want to just say that I'm so thrilled and honored that all three of you are here with us at the summit. There's a lot of information to share about what's happening in Ohio. And Yolanda, I'm just going to simply turn it over to you to take it away. Thank you.
Thank you, Melissa. Good morning, everyone. It's so nice to see you back for the second day. I'm Yolanda Lewis. I am the Senior Director for Safety and Justice at Pew Charitable Trust, and I have the distinct honor and pleasure of hosting our fireside chat today with two amazing leaders from Ohio. I want to start the morning off with a little bit of laughter because they told us this was going to be a fireside chat. I'm looking for my glass of red wine in the fireplace. It's coming. It was a bit confusing, but I'll make it work. I'll make it work. I think that we will start by just, of course, adding our thanks to Sozosei and the leadership here for having this summit and also inviting us to have this conversation about the work that's happening in Ohio. Now, I will not take the liberty of introducing these two brilliant people who are on the stage with me. I think you can read their bios in the packets that you have, and you will see that they have a number of accolades that stem back years from government, covering a range of leadership experiences that make them not only advocates, but also experts to be able to do this work. And I'm honored to sit beside them as they chart a new course for care and how it's delivered to Ohioans. So just to level set a little bit today, we're gonna cover three themes in this conversation. We're going to talk a little bit about the vision of crisis response and stabilization in Ohio, how that has evolved, what's driving the conversation in Ohio. We're going to talk a little bit about 988, which we've talked about throughout the course of this summit, and talk about how that fits into the broader mosaic of what they're doing in Ohio. And then finally, I think we will talk about private and public partnerships and how a lot of collaboration can really drive forward strategic implementations of really good interventions. And so that's where we're going to kind of set our conversation for today. So let me give you a little bit of background. So as we go into the conversation, you'll have a sense of what we're talking about here. So according to Mental Health America, nearly 25% of Ohio adults experience mental health or experiencing a mental health issue. Now, as a matter of perspective, just 3 states reported higher figures than Ohio in 2019. Ohio has a county-operated, state-supervised behavioral health system in a home rule state, which means that there is a local behavioral health tax that is levied to help provide additional resources for recovery and support in most communities. So as you can imagine, in the state of Ohio, they've experienced record numbers of individuals seeking care for substance abuse disorders, as well as mental health concerns. And like many communities beyond the state lines, they're depending on emergency departments like ERs, as well as police to be able to respond. And we know that those resources need more infrastructure to adequately assess, stabilize, and connect people to the care that they deserve. So, but despite all of that, these folks have a lot of benefits in the work that they're doing. They're continuing to do transformational work because there is strong cross-sector consensus that protecting and responding to people in crisis is a priority in Ohio. And there's a demonstration of commitment from all levels, including the executive leadership and the in-state national philanthropic support across the board. So that starts our conversation today, and I'm going to kind of jump into things with Rick and Lori. So one of the things I've learned with working with you all is that you have this really grand vision for how you want to work in Ohio and what you want to see happen for outcomes for people. I think part of your strategy is to connect, respond, stabilize, and thrive. So let's start there. And Director Criss, if I can kind of start with you, what's the vision for crisis response and stabilization in Ohio?
So for us, we're working from a position where we want crisis services to be visible and accessible to every Ohioan, that everyone will have a fair and equitable opportunity to access those services, that the services will be person-centered and will be high quality, and that they will be a safety net that underscores a true community-based care system. So crisis services are not, they're centerpiece work for us. It is a significant part of the work that we're doing in Ohio, but it's not all of the work that we're doing in Ohio. We are working every day to make good on those promises from the 1960s of having a true deinstitutionalization of hospitals, jails, prisons, where people can live and work, learn, play, pray in community with their family, with their friends, and really thrive in a way that helps them live their true God-given potential. And that leadership comes from the top. So Governor DeWine is very focused on making sure that every Ohioan has fair and equal opportunity to live their best life. And he was trained as an educator, and so he's very interested in children and youth and families. He was a county prosecutor, and so his work in that system quickly helped him understand the impact of mental health conditions, substance use disorders, child welfare, and trauma, and the trajectory that those issues can play in a person's life and their overall health and wellness. And he's carried that work with him throughout his career. So it's very exciting to work in an administration that's focused on and interested, and not just our Department of Mental Health and Addiction Services helping to amplify voices, lift people up, and make sure services and supports exist. But the expectation is that that's happening from every cabinet level agency in our department or in our administration. And so on the first night that he was sworn into office, he created Recovery Ohio. And Recovery Ohio is a team in the governor's office that coordinates activities, policies, funding across the administration to make sure that we're working together to make life easier for those organizations, philanthropic, for-profit, corporate, nonprofit, healthcare agencies that are local governments that are working to advance the interests of people living with and recovering from mental illness and substance use disorders, but with a strong focus on prevention as well. And so this vision for crisis services fits into this broader approach that's interdisciplinary and really does play into that home rule state, that sense of these issues are happening in homes, with families, in communities, and state government has a role in helping to facilitate resources and policies and practices. But really, it's those local communities that are identifying the needs and identifying the solutions, and we are playing a supportive and facilitative role in helping them accomplish their vision as well.
Yeah, so the interesting is I'm president of a foundation in Northeast Ohio, and so philanthropy sometimes has that role and that ability to also be that over time longevity accountability entity to say, when somebody like Director Criss says, hey, we're doing great stuff, well, are you doing great stuff, right? And of course, she's getting nervous now. What's he about to say? I want to advocate for our governor and for the work that Lori's done. And when she describes this sort of unified effort, this cross-disciplinary leadership that occurs at the state level, it really begins with our governor, who has a sincere interest in cares. Like he's somebody that when he says, hey, I care about the seriously mentally ill and folks that are dying of overdose, like it's not rhetoric, it's not political positioning, it's real, actionable, and now I want my team, of which Lori is a critical part, to do something about that. And it was evident a couple years ago, soon after, it was the end of his, I think the first term, And I ended up in a meeting with some other philanthropy, and it was Lori and all of her counterparts in public safety, corrections. We had provider organizations, advocacy organizations, NAMI Ohio, different representatives. The Behavioral Health Authority folks were there, and you don't often see that in state government. So I'm proud to be from Ohio, and to, not that it needs to be said, but I want to validate what Lori is saying about the interest, and it takes, so for those out there, they're like, well, how do I do this in my state, or what do I need to do? You need leadership at the top that says, this matters, we care about these people, and it's not to get elected, it's to actually make life better so that people can thrive. Mm-hmm. And that's what's been great about this partnership and the work in Ohio, and that's the vision, is that folks can live in their community, love, pray, be who they can ultimately be, not have their life disrupted, like Miles and others, and that's that's the vision ultimately of all of these systems that Lori mentioned. So
I want to just kind of touch a little bit on this collaboration piece and this joint vision. We often talk about, like, everyone is so excited that mental health and just behavioral health issues are now rising to the top as a priority in government and in philanthropy. And I just want to know, the numbers I quoted were from 2019. What has changed? Is anything accelerating that priority in Ohio? And what does the accelerated prioritization mean for you as state officials and as philanthropy?
Mm-hmm. Well, so a couple of things have happened since 2019.
Small thing called a pandemic.
I was going to say, I know exactly what she's going to say.
Right. I mean, well, coming in, so I've always worked in the private sector. I started my career at the Commission on Minority Health, which was just a tremendous opportunity to learn from really a national leader in minority health and health equity and health opportunity. And then I quickly moved into working in community-based services, and there was able to work in a very person-centered environment where 65% of my colleagues were people in recovery, and including the leadership and the board. And so I feel grateful to have grown up with those mentors who helped me really in every single moment, and this is relevant to your question, I promise, in every single moment, stay focused on people and not get distracted by everything else that comes with a role like the role that I'm in, and to stay focused on the humanity and dignity of each person and the experience that they're having with our system and that their families are having with our system. And so over the past 2 years, I'm really grateful for that grounding, because the pandemic has added this element of stress and anxiety for all of us. And it has certainly impacted people with mental illness who are more vulnerable to the virus than people without, to traumatized communities of color, Appalachian communities, and so those things have changed. I think there's a broader recognition of mental health conditions as well, and so helping to really talk about what's a mild and a moderate condition and what's a more significant condition. What is, everything isn't pathologized, right? So we don't want to have this conversation in a healthcare environment about me feeling sad is not the same as someone who's experiencing depression. Me feeling stressed and nervous is not the same as someone as having an anxiety disorder. But all of it's relevant, and all of it's meaningful, and all of it needs to find a pathway to wellness and to care. And so over the past 2 years, we have seen an opportunity to really talk about that in press conferences about the pandemic, always having that mental health, that substance use disorder lens, that opportunity to say into a microphone, into millions of homes, don't use alone. Carry naloxone, call 911. If you're feeling like you might hurt yourself, if you're feeling overwhelmed and hopeless, here's a number to call. Here's, you know, and using the National Suicide Prevention Lifeline, starting the Ohio Care Line that was meant for people to get emotional support. So those things have changed. We have seen an increase in anxiety where, you know, and I think this is national. I don't think it's different in Ohio necessarily. Our overdose rates and overdose death rates increased. Our suicides have actually decreased. Completed suicides, but we're seeing increased suicidality, increased demand for mental health services, particularly among youth and young adults. And so it just, throughout all of that though, I'm so proud of our team and our community partners, right? I mean, I look to the system of care, the local leadership, those healthcare organizations, behavioral healthcare organizations. I'm so proud of what they've accomplished in quickly pivoting to using telehealth and in-person services, truly creating choice for people. So making both safe and both high quality so that we didn't see a decline in access to care. Ohio, when you look at our Medicaid claims, we quickly ramped up telehealth to the point where there was no decline at all in the level of service volume in behavioral health services in Ohio for those recipients of Medicaid. And so I'm really proud of that work that has been done and the gains that we've sustained, the initiatives that we've started. We have an infant mental health credential now. We have expanded early childhood mental health. We have been able to invest dollars into really growing local community coalitions, suicide prevention, behavioral health, mental health promotion. So really doing a lot of work that is growing this community understanding and capacity at a time when I think we need that. And at a time where people could have gone into their corners and gotten competitive, right? We really have come together in a way that has been, we've sustained that true collaboration and really stayed in constant communication and contact, always with the person at the center of the target.
Yeah, no, I would echo that. Like, I think the pandemic in our state, I feel, first of all, how the state government led us through it was amazing. Not perfect, of course, but it's those moments of crisis and difficulty, you can either get a lot better or a lot worse at what you do. Mm-hmm. And I think what Lori's describing and I see as philanthropy is, there's two conversations that occurred in the network of philanthropy in Ohio. Very reactive, quick, throw money at stuff. And then there was another conversation that was about what in this moment of disruption and pandemic, and is there an opportunity to make systems better? And that's what I saw happen, not universally, but it became an opportunity versus a threat to what could be for individuals in our state. And it's a work in progress, for sure. But that's what's changed. It's funny. We were talking last night that, I would like to do this job when there wasn't a pandemic.
That would be so nice.
Like the amount of time that I watched and it's true from cities, counties, all the way up to state government. We're talking state because Lori's here, but the bandwidth and time that folks had to spend and needed to spend, because that's the job, is to do that, was incredible. Yet there was still a lot of other opportunities and things to get other things done systematically. The other thing too is I think one of the things that came out of the COVID was the stigma around, when I started my job almost 16 years ago in philanthropy, my founder didn't talk about her son's schizophrenia, hush tones, addiction, hush tones. My daughter was cutting in high school, you didn't talk about it. Mm-hmm. And now, mental wellness, it's health, right? It's mental health is health, and that's how in Ohio we think about system crisis emergency services. That's how we think about it, and They're separate right now, but that's where we envision that opportunity to make that better. And that's why I think COVID-19 has given us an opportunity to do things that we would have taken, like telehealth, the example or used. We were 4 years away, 5 years away from the type of telehealth services that were delivered within a couple months of when the pandemic, we shut the state down and the pandemic was upon us.
Rick, you talked about opportunities, and we know with every good opportunity came a challenge, right? And so one of the panelists yesterday talked about crisis stabilization, and it can mean a lot of different things. Also talked about how it could mean something depending on where it's being implemented. Can you talk a little bit about what's the most significant challenge for effective crisis response and stabilization in Ohio?
Yeah, that's an easy one, Yolanda. I appreciate that. Where's that wine in the fireplace?
I know.
Right? So the challenge is always going to be will, right? The will to be disruptive and not defensive or protective of existing systems. I think one of the greatest challenges we have is with a lot of additional resources that are flowing from the federal government on down, is do you reinforce an existing system, or because it's easy to do, or do you create and improve, if you even want to call it a system, create improvements to those responses? So that's one challenge, and I'll just rattle off like 5 if I can. Another is access to good data. How do you use data to drive smart work? There's a lot of models across the nation. In Ohio, we've got we think in terms of connect, respond, stabilize, thrive, which aligns with, I think, Dan Gillison from NAMI National said it yesterday, like someone to, from a person, like I got someone to call, and if I need it, I got someone to come, and if I need it, there's somewhere to become safe, right? Is that it's having that template, but then how do you know what works in Appalachia, Ohio, versus Akron, Ohio, where I'm from, home of LeBron James, by the way. And now I promise school, did I say that? I'm the other kid from Akron, not that one. To be careful not to dictate to a rural community that, well, over here in Akron, this is the way to do it, and to listen and to those leaders and let them right-size work that will work for their community and the types of services they need. Challenges, yeah, there's a lot of them. And I think that the last one I'd say is, and this came from a guy named Dr. Mark Munitz, co-architect of the sequential intercept model, who's one of our local heroes too, is, this is a long, I use fight because I'm a military guy. This is a long process. We heard like 1960s, 911. This is we're in a revolutionary moment, but it's an evolutionary process. And we have to make sure that leaders know that we're in for the long haul. We're just not trying to do something between now and July. So now 988 works. All right, guys, we're on to the next thing. No, I don't think that's going to help. It's going to take a lot more than just, it's going to take a lot of time to get the system response that we need. So it doesn't matter what zip code you live in order to get good access to the care you need in crisis or not in crisis.
Yeah, and we are playing that long game. And that's something that, I'll just go back to Governor Mike DeWine, that he expects of us. And he talks about planting seeds today that will have trees that will produce fruit decades from now that we might not see the benefit of, but do the work anyway, right? It's not about the credit, it's about the long game for Ohioans. And so that's an exciting opportunity as a leader to be able to make those types of decisions and investments, and to really be cautious and understand the environment that we're in, but the environment that's coming, and to look, understand that history of what we're building on, that strong foundation, using the appreciative inquiry approach of grow what's working, make it better, and add things in that will help carry us into the future. Those are incredibly important. I think one of the other challenges in Ohio, and we talk a lot about, you know, the national, the federal response, the state response, but again, Ohio is a home rule state. We're local rule. And, you know, if you haven't been to Ohio, you might have this thought that we're not a very diverse group of people. But in fact, we are. We're a test market for things like the McRib and other delightful experience brought to you through Ohioans. For a reason, though, right? Because there's so much diversity. We have mountainous regions and rural regions and agricultural regions and urban cores and metropolitan and suburban areas. And we have a lot of diversity in our people, also, you know, people of color, Black and brown people who were born in America, a lot of immigrant populations. We have an incredibly diverse 11.7 million people, and the geography, and we have 88 county governments, and then you can go into townships and cities beyond that. And so we are constantly looking at this diversity, at this opportunity to make sure, again, that everyone has a fair and equitable opportunity to have their needs met in a way that is relevant to them, and that is best done locally. And that's a challenge. You know, it's an opportunity and a challenge. So as we've done this work, one of the first things we did in early 2019, that's when I started in this role, was to create a crisis academy. We had people who had the opportunity to go and visit other parts of the country where good crisis services were blooming and taking root and really showing outcomes. But every Ohioan that was in this seat, in this opportunity, didn't have the chance to do that. So we started creating crisis academies. We have 50, they're called alcohol, drug, and mental health boards. They are the local planning authority for behavioral health services throughout the state of Ohio. And each of them created a team of 10, and those teams were expected to be diverse. So law enforcement, healthcare, superintendents, providers, people with lived experience, family members, all coming to the academies, sitting, listening, and learning together. We are, I think, at our 9th one. We're doing competency restoration next month is our next topic. We just did kids mobile response in November. And really that opportunity to bring the experts to Ohio and have each community listen and learn and think, what do I want to do? What kernel came through to us that closes a gap that exists in our community? And then coupling that with funding. You know, so our General Assembly has been a great partner, very generous in their work with us. We've had $69 million just in state dollars invested into this so that we could then help stimulate those activities, match philanthropy, bring people to the table to help plan at that local level to close those gaps and advance the work. So we're growing mobile crisis, we're growing crisis stabilization units. We have co-responder models in certain communities, recognizing that every community doesn't have a hospital. Every community doesn't have really EMS. You know, I grew up in Mingo Junction, Ohio. Dean Martin would be, it's not LeBron James, but Dean Martin's our most famous citizen.
There's a clear competition.
That's right. I mean, he's our most famous Jefferson County guy. And anyway, it's that experience growing up in a village of 3,000 people, and then now living in Columbus for the second half of my life so far. Very different experiences, but I know that we went to Pittsburgh when we needed health care.
Yeah.
You know, we didn't even stay in state. We went out of state, and we got great care, but we came home to an environment that was supportive of us, and we could get what we needed. And so those are experiences that are challenges that we're navigating in Ohio. And then workforce, I don't have to go into that, but workforce, we have jobs that sit open, not because we don't have money, but because we don't have people to fill them. And we've done an aggressive study on the supply and demand. We've had a 353% increase in demand for behavioral health services over the past 10 years. And we've had a 174% increase in workforce, which is exciting, right? Because I think that we don't really think about having an increase in the workforce, but it doesn't match the demand. And when we project into the future, we know that we need even more. And that's everything we've talked about: peer support, navigators, youth and family peer support providers, and then professionals of all types as well.
Perfect. I want to get into 988, but before we do that, I want to just kind of pivot into the private-public partnership. I'm former government, and I know how important it is to, make it to the point where you have appropriations at a state level to support the work. I also know now how important it is to have philanthropy at the table and what that looks like from the perspective of scaling, expertise, and things of that nature. So let me just start for both of you to just kind of figure out from your impressions, how might philanthropy best work with state and local governments to improve this work? Because I don't know that it's a natural thing in every place, but it seems to work in Ohio. Mm-hmm. So how are you navigating that relationship specifically?
Hey, we're here hanging out together with our wine by the fireside.
Wine and fire.
Yolanda.
Yeah.
I think what philanthropy can do best is to be supportive, also to assist, but also be willing to create accountability. And what philanthropy shouldn't do is come in with the impatience and tyranny of the urgent of here's the hot thing, come in and start dictating, hey, here's what we need to do, and start telling folks like Lori and everyone else across the state, those idealistic, in the ideal world, this is what things should look like. And it's a journey to get there. And philanthropy has that opportunity to enhance that effort and that progress. Can also make mistakes in that too. And I'm sure we've done it as a foundation, but to be that supportive, collaborative partner, and also activate, like I think about, I guess we're kind of a statewide foundation now, which isn't what we originally intended to be. But part of my role is to activate philanthropic partners in places that, into this work, activate them and help lead them too, and be sort of that facilitator guider. Because not every foundation, I think somebody said, I think it was Chuck Browning, hey, you've been in one community, you've met one community. That's about how philanthropy is too. You met a foundation, then you've only met that one. Everyone is different. We all think we're the smartest and brightest and sharpest. And really, it's just Peg's Foundation that's that, right? In Ohio. There we go. We got laughter. It's a fireside chat. We're all supposed to be hanging out with our wine. But it's to be that supportive enhancement, not that entity that really is more trouble than they're worth, because then you're avoided and ignored, and then you're not working. You're working at cross purposes instead of together.
Well,
yeah, I guess I would say I think that the opportunity that exists in Ohio, and I'm sure it exists other places too, that's my experience, is really philanthropy as a convener in a way that government isn't. Mm-hmm. And I think that we really embrace that. And we look at private foundations, also corporate philanthropy. Your reach and your ability to innovate and really push. You started out by saying, you talk about the great things you're doing. Are you really, right? And that was a funny joke that Rick told at the beginning of the conversation. But it's a true thing, right? That accountability in both directions, convening, investing, and the opportunity to have those conversations in the local communities as well. Government, especially in healthcare, can only really do so much. And this comment was made yesterday, or maybe it was this morning. And I learned this from Cheryl Boyce at the Commission on Minority Health. It's the people who make the difference, right? It's the people who make the change. And when you bring government and philanthropy and the nonprofit and for-profit sectors together, you can really advance that in a different way than you can if we just try to do that lift by ourselves.
Absolutely. So I want to move into the promise of 988. Mm-hmm. And I think we're all very clear beyond the pandemic, 2020 and 2021, to a certain extent, has been, no stranger of tragic headlines around how police are responding to individuals with mental health issues. And, from Walter Wallace to a host of other names that we now know, we are starting to really come to grips with the idea that police are not the right response to people who have mental health challenges, and they were never intended to be, and so that's an unfair burden for them. Recently, Pew released a study that suggests that while there are millions of 911 calls involving persons with emergencies related to mental health and substance use, call takers and dispatchers just lack the resources to be able to properly respond, whether that's training, protocols, or diversionary tools. And so often that gap, the confluence of that gap, really results in challenges that can be traumatizing for communities and often tragic. So we talked a lot at the summit about 988 and its promise and what that means for this field. Tell me what you hope it means for Ohioans.
So I think long haul, more visible, more accessible care where people are when they need it is the true vision. And that's going to take a while, right? So I think over the past several months, since last February, working through our planning grant from Vibrant, convening over 100 constituents from people, living with and recovering family members, telecom, law enforcement, the whole gamut, really understanding and recalibrating what success looks like at different points along this 988 pathway, right? So what success looks like in July will be ensuring that we have coverage for every community with calls, texts, and chats to the extent possible with the texts and chats, because that's still evolving technology, and that those are high quality responses, that we have an online web-based directory so that no matter who answers the call, that people get information about the services and supports that are available in their local community and get a mobile response team dispatched or a stabilization center near them that they can go to. So that's what success looks like in July, having that basic infrastructure. Beyond that, we know that ideally we will have a behavioral health response to every single call, mobile response or stabilization unit for every Ohioan when they call, where they are, when they need it. That doesn't exist today. I mean, I talked about Appalachian Ohio, I talked about rural Ohio, urban communities. 50% of Ohio's population, we're the 7th most populous state with 11.7 million people. 50% of us live in 8 communities. So 50% of us don't, is the big takeaway, and from a planning standpoint, right? Which means the 50% of us that live in an urban community or a metropolitan area are much more likely to be able to get a mobile response, and not just a mobile response, but an evidence-based practice for youth and families if you're a youth in crisis, MRSS, or a mobile response that's behavioral health oriented if you're an adult in crisis. Again, that doesn't exist everywhere. The preponderance of our workforce is in those metropolitan areas as well. So while it's not ideal, we do have to rely on first responders for competent, high-quality, compassionate care. And we have good partnerships with them in helping to train and implement those services and supports. We have to rely on emergency departments in hospitals to be that crisis stabilization center right now, and we will into the foreseeable future. But we can have psychiatric response teams in those emergency departments. We can have opioid response teams, addiction response teams in. We can have peer support providers in these more traditional healthcare settings that help create a better experience, a more, you know, person-centered, human, dignified experience for a person with a substance use disorder or mental health disorder that's in crisis. So, you know, kind of recalibrating, using what's available to us, closing the gaps, and building out towards this preferred future that we'll be aggressive in pursuing together.
And before you get this respond, I want to push both of you a little bit, because I know when we talk about 988, we talk about it really from a behavioral health sense, right? To a certain extent. My former career is in justice, and so I'm always waiting for the justice part of the conversation. And so I just, Rick, as you're coming in, if you could just, in your response, talk a little bit about folks are still going to call 911, right?
Yeah.
Right.
That is the expectation until something different. There's data to suggest that we're doing something different. How are you bringing them in?
Gotcha. And then what's the capability if you do call 988? What is the capability of that?
That's right.
What's that triage or that decision tree look like when that person takes that call? And the previous panelist said like 90, 95%. I know. You know, you can handle a lot of those when you have someone to call, and I always say, if need be, then someone to come, because the idea would be is if you can catch on that call and de-escalate. So one of the other things that we're proud of in Ohio is the crisis task force that falls in under Lori's leadership and her department. And that task force includes a 911, 988 interoperability. So, yeah, and of course, you know, 911 is in a different department. So we've got, it's actually in two different departments certainly outside of Lori's department. But to activate individuals in those systems and have them be part of the task force and talk about how people are still going to call 911. People are still going to potentially land in and around the jail depending on how they enter. Yeah, I think we have like 113, maybe it's more than that, PSAPs in the state. I didn't know what that was 2 years ago, like what that stood for. And if you're in behavioral health work in a state trying to implement 988 and you don't know what that stands for, then there's no one in the law enforcement community that understands you, because that's a key element to how the law enforcement side. And then you said justice system. We're fortunate because we have, for the past 5 or 6 years, you know, the National Stepping Up, which nowadays is sort of like, oh yeah, that's that. What's the new thing? Well, that was organically. We took the principles of Stepping Up in Ohio in partnership with Governor DeWine, when at the time he was the Attorney General, and created an AG task force that's continued, that's continues still to activate at the county level, sort of that there's this national top down and then this organic bottom up, which is what we're good at in Ohio, is in a county, what does a stepping up county look like in Ohio? And you create those collaborative, and this is my message to any other funder in a state that's interested in this, is you've got to have champions and you've got to have good leadership and you've got to have people that are organically willing in their community, and the way that Lori described, what's my community look like? I want things that matter to us and fit us here in Appalachia or in an urban community, and get those conversations going. It sounds so like cliche to say it, but we went into counties like sheriffs, hadn't talked to the mayor, and now all of a sudden they're talking. Well, now you can start thinking about systems change instead of just platitudes about what we're trying to do. So I view this as, you know, folks that are in behavioral health distress, you know, may interact with police. And, you know, crisis intervention team training. I know not everyone's excited about CIT, but in Ohio we're excited because a lot of our police officers, I mean, we have 15,000 police officers trained. Every county, we got a county that has like one police officer in it. So if that individual retired, then we don't have every county covered. But we have, it's pervasive. Like, and our police embrace give me more tools so I can be better at my job when I interact with people that are in distress and potentially disrupting, are disruptive, or can be, based on their illness, not based on a desire to do harm, and having good reactions to that. So I think this moment in time, previous panel talked about it, was, 988 represents an opportunity for us to think bigger about our crisis emergency responses, the whole continuum. And the most important thing, and I know this is what drives Lori and the governor, is we want people to thrive, right? Well, you can't thrive if you're in distress. You can't thrive if you're in a stabilization center, right? You can't thrive if you're in jail or boarded in an ED, or homeless. It's hard to do those things. So it's figuring out, this is an opportunity for us to address that. And that's, I wandered off your question. It's a fireside chat. What do you expect?
Yep.
No, but people really have avoided care. When you look at some of the reasons through the SAMHSA research of why people don't access care, part of it is visibility. They don't know where to go. And part of it is financing. They don't know how to pay for it or if it's paid for. Part of it is really fear of losing control. So if I reach out for help, will I be arrested? Will I be involuntarily committed to services? And that's terrifying. So now I wait until I decompensate so much that I end up being arrested or involuntarily committed because we don't have this robust behavioral health response that gives another pathway for our partners in public safety, for our partners in healthcare. And so, 988 really is creating this opportunity to push that envelope and create that over time. Again, we're not promising that's what's going to happen in July, but the first step, that first milestone is there in July for us to even be having these conversations in the public around what should be and how we're going to get there.
Perfect. So we're going to take a couple of questions from the audience, and I think parting thoughts from the both of you. So if we could start here.
Hi, thank you. Debbie Plotnick, Mental Health America. And I want to start by congratulating Ohio. Several years ago, we gave Governor DeWine our Mental Health Champion Governor's Award. The program in Ohio is really spectacular. But I wanted to bring up another point that we at Mental Health America are seeing, and that's through our screening website. And this has traditionally been the case, and it's even gotten bigger, that about 40% of the people who are coming, and our screens are way up in the last few years, we've had double the amount of screens than we've had in the previous 5 years, is that they're young. They're between 11 and 17. And Governor DeWine really appreciates this, and Mrs. DeWine, both of them being educators, that you really have to be paying attention because kids know when something's bothering them. But if they can't speak out, if they can't get supports, it's really problematic. So what other things is Ohio doing to support young folks and to get them the kinds of things they need so they can thrive?
Yeah, thank you so much. That's a fantastic question. And there were two areas of focus that I had when I came into the seat. One was building out crisis and deinstitutionalization, and the other was early identification and intervention. And so we really look at the fact that 75% of mental illnesses and substance use disorders start before the age of 25, 50% before the age of 14. We have these critical times in a young person's life to make a difference in early identification, understanding the signs and symptoms, understanding the risk factors, integrating that work into primary care and pediatric care, understanding family history and the role that it plays. So there's work around stigma reduction, making it okay to talk about mental health and addiction, substance use disorders, dangerous or problematic substance use, right? We don't have to have this all or nothing thinking. And so really bringing that into that pediatric setting and to the family setting and school setting. We have significant investments, $675 million per biennium, so that schools in Ohio can have the right services and supports K through 12 And we've also extended that into the 18 to 25-year-old age set. A lot of that's on college campuses because that's an easier place to find that age group, but we know not everyone goes to college, so doing some of the outreach to careers and other young people as well. One of the things we're doing right now is creating a student assistance program, and this will be in schools across the state. We're piloting it in 80 schools right now. So it will engage navigators, family peer support providers, which we just are starting a credential for and licensing in Ohio, so that we can help take the mystery out of that experience, help understand the difference between when is this just adolescent behavior and when is this something that is potentially a early sign of something else. So growing those student assistance programs to help people connect to care. And then also expanding our first episode footprint so that we can have more immediate interventions and support for those youth and young adults who are having a first episode and get them more immediately connected to care. I could talk about a lot more, and I'd be happy to on break if you're interested. Yeah.
We have another question.
Yeah. Good. You mentioned the CIT trained officers. So here in Philadelphia, we have that too. It's not mandated, it's by choice. And in my opinion, I think it should be mandated because the way the police officer interact with mental health patients all the time. And you sounded so excited about your officers over there in Ohio. So my question to you is it mandatory or by choice over there? And the second question is, how did you get your police officers so excited to do this training?
So, my experience, I would like to take credit for it, but we had a really, I mentioned Dr. Mark Muniz earlier. He and some others brought the Memphis model to Ohio, and it's the best way to describe our experience in Ohio is for it to be mandatory. I can't speak to whether it should or it shouldn't be, but I know the officer that experiences calls and isn't equipped to handle those calls wants that extra tool. One of the challenges with CIT, and it's a 40-hour curriculum, and that's 40 hours of somebody's, that's time times money, and but our experience has been that so I'd answer it this way: police officers don't want to be in that situation. The vast majority in law enforcement shows up to do their job and do it well. And CIT allows them to do that job better when somebody is standing naked in psychosis in the middle of Main Street directing traffic. What tools does that officer have other than to tackle him, cuff him, and arrest him? Well, no, maybe through CIT, I'm going to have a better set of skills to handle that. So what I would caution, though, is a police department, that's easy for a police chief, and I don't know, I hope there's Philadelphia folks don't get mad at me, but it's easy to stand up in a city like, say, Philadelphia and say, hey, we're going to make CIT mandatory. Okay, now we're done. Now what? Forget about Walter Wallace because I fixed that problem. Well, no, you didn't, because maybe that initial point of interaction, but now you need the services behind, you need the capacity behind those officers that when they de-escalate, now what happens? Now I can get this individual to a jail or emergency room. We need something different than that. So,
well, I'm speaking from a person with experience that was in that situation. That could have been me. I worry about my child who has mental health disorders. That could be him. So, and I also speak at the CIT training here in Philadelphia to the police officers who are willing to take it. So that's very important to me. But so if they don't make it mandatory, and the ones who don't take it, they still have contact with people with mental health, because if I call mental health services for a crisis I'm having with my son, or vice versa, my son was having with me, right? If I get 302, who do I take him to the hospital? The cops. The process here in Philadelphia, you got to call the people, they got to come, you got to fill out the paperwork, and the cops is the one who escorts you. And sometimes that escort don't go so great. So whether it's I'm calling 911 for the situation going out of control, or I'm calling about 911 because I'm getting 302 to the hospital. A police officer is still dealing with a mental health patient. This is why I think it's important for them to be mandatory trained to deal with mental health patients. Because it's a part of their job. They're not trained to do that, but they interact with them.
No, that's a fair perspective, and
I'm just speaking on my own.
No, I hear you, I don't disagree with you at all. I think the importance of CIT is a tool because, as Lori and we've all said throughout this conference, is in July this isn't all going to be sorted out. So police are still going to respond through 911 portals, through 911 PSAPs to come out and interact, and they can be better, and I think the vast majority of police officers want that. Making it mandatory, maybe that's a super idea. We haven't had to do that in Ohio, so we're fortunate, but it's, there's a lot of mandatory police training that police officers go through, and I think there's some I know there's some former police officers here from Meadows Mental Health Policy Institute that I know could add perspective to this, but we believe in what CIT allows our officers in Ohio to be better at interacting with folks with behavioral health and substance use disorders, and it's something a city like Philadelphia should consider if they can't get volunteers.
From a very practical perspective, we partner with public safety, with the Buckeye Sheriff's Association, with the chiefs of police. They market and they engage in recruiting people for the classes. That makes all the difference. We pay for the classes, and we pay the salary, the wages of the officer that has to backfill that position while somebody's off at training, and that has made it much easier for the local precincts to be able to send people to training when they don't have to cover the cost of being down a person in their public safety role. So we have some of those partnerships as well that make a difference.
What Lori just said, and this is an important point, like the opportunity for states, for folks listening out there, is when you partner, you said Buckeye Sheriff's Association or Police Chiefs Association or provider associations, you build that tent, you bring those folks into the room, it's a lot easier to motivate folks to change and do things differently. To have the governor say, hey, I want everyone CIT trained. Well, if you can get the associations to partner with you, that message is heard a lot more clearly at the organic level. And that's the leadership that we've experienced in Ohio, and it's been great. And that's the one nugget I'd give to folks is find those partners and have those conversations before you decide what you're doing and build that will.
So I know we have some additional conversations that need to happen, and I know we have additional questions, but in the interest of time, I know you are eager to continue the conversation. I encourage you to do that. Lori and Rick will be around, and I apologize that we didn't get to all the questions. I want to just take a moment to thank Lori and Rick for their leadership in Ohio. I also want to thank them for their transparency today, really kind of laying it out on the line, because there's a lot of work to be done. There's great work happening, but there are also challenges, and you should know that. And then finally, again, I want to just thank Sozosei for just allowing us this opportunity to really be able to talk about the great work that they're doing. And I'll leave with this parting thought from Rick, which is what we are trying to do is the right size work that works in communities. So thank you for your time.
Thank you.
Thank you, that was excellent. And again, apologies, I didn't know you all needed a glass of wine to do such great work. I think you were fine as is. Let's take a super quick break so we can get our South Carolina colleagues up onto the stage. Thank you.